I was visiting my youngest son. He had a dog that attacked me. It was very sudden. We went to the emergency room. I was gushing blood from many different places. One of the things that he did was bite off a decent chunk of my lip, which we found on the floor, but my son was able to pull him off of me. So I really am lucky. I know I am. But it was still very traumatic to go through. It was very impactful for me. One day I'm gonna have grandchildren, and I didn't want them to know me this way, to have the signs of the attack so visible. Oh, sorry, it makes me emotional.
So you went to the emergency room first.
The ER doctor said to me, you should have a plastic surgeon doing this, but we don't have anybody here. I'm gonna do the best that I can, but you're gonna need to go find someone. So I started talking to surgeons right away, and it was very discouraging.
How many did you see?
A total of 12.
And then what did they tell you?
Most of them recommended the Abbe flap, which is an incredibly intense procedure, and your mouth is sewn shut, and I didn't even think psychologically I could do that. And then the rest of the surgeons suggested revising just the left side. They didn't think there was anything they could really do over here. Some people suggested fillers. Mostly what was so discouraging was having people look at me time and time again and say, it's not that bad, and you should just live with this. And that didn't feel like true for me.
I see. So how did you find me again?
I found you through a dear girlfriend who is good friends with Dr. Abbe, and he said, this is the only person you must see.
Okay, so let's take a look. So the injury is here, mostly on the right side, and there's vermilion tissue missing here.
Yeah.
And the scar on the vermilion border sort of distorting the white roll. There's actually no white roll here. You have a sinking vermilion, which you have naturally. So there's a notching right here in the lip. So when you smile, there's another piece here that seems to be in excess, but that's your normal lip, I think. So close it. On this side, there's a sinking vermilion here. So this is going to take quite a bit of thing. There's no Cupid's bow here. So we're going to see if we can make you a Cupid's bow. And then I don't think you quite need the Abbe flap. So
Thank heavens.
I think I have an idea. So this is going to be like a vermilion lift. So we're going to create a new Cupid's bow right here. We're going to remove this tissue, bring this up, bring this corner up, continue to remove the scar here, and give you a new vermilion border, the white roll. We're going to have to create that and create that. We're going to have some eversion of the vermilion lip, so this is going to be helpless. And then we have to do a corner lift here, and we have to limit the lateral extent of this incision, so we have to do something to bring this back down so this scar doesn't extend out like this. So it's a little tricky thing to do, but it's doable. And then a laterally based lip lift with the internal corner lift to give a little bit more corner lift here and here. We need to lift this side more than the other side, so we're going to bring this up like this. And then this little tissue here that we're going to get from the basal resection for the laterally based upper lip lift, we're going to use that tissue to support the vermilion here that's missing. And then we're going to fat graft the whole thing. Okay?
Okay.
That's what we're doing.
Okay.
All right?
Yep.
So we're now 3 months after our lip
Reconstruction.
So we actually did like all 3 maneuver of the lip lift technique that's ever existed in mankind. So we did, so you had a dog bite.
Yes.
That you were missing half of your lip,
Yep.
right? We did a laterally weighted upper lip lift with a vermilion lift with a corner lift and with a little fat transfer in the lip now. So 3 months after, right?
Yep.
And
Still healing. I mean, still gonna get better and better. It's really feels like a miracle to me. I didn't expect I would ever be able to look in the mirror again and see the face that I recognized, or just be able to smile and own my smile. And I can, and I am every day.
so you had gone to a couple of doctors.
Well, I went to a lot of doctors. Some wanted to do the Abbe flap, which
Right.
sounded very scary. and meant my mouth would be sewn closed for 2 weeks, which I didn't think I could do.
So Abbe flap is taking your lower lip, cutting a piece of it, attaching to your upper lip. It will be attached by a blood supply. Then you cut up that blood supply, you detach it after like 2-3 weeks.
Yes.
And then so you have more tissue in the upper lips. And I didn't think that was a good choice for you.
Thankfully.
So we were able to do this without doing the Abbe flap.
And I have my smile back. You gave me the rest of my life being able to smile and talk and not feel self-conscious.